Well, I would say that the Pentacam, in terms of IOL power calculation, is a kind of Swiss knife. It gives you everything. You get the anterior cornea, you get the posterior cornea, both in terms of spherical equivalent and toricity, so you can do your regular calculations as well as your toric calculations, and then you can now get measurements within the eye, so you get the axial length very precise and accurately, and I got all the numbers I need to use modern formulas and get very accurate results. It compares very well. We have done studies regarding precision, repeatability, and agreement. So in terms of precision, we've seen that the Pentacam is one of the most repeatable measurers of the anterior and posterior cornea. We have got in different assays within subject standard deviations of the CMK of around 0.07 diopters, which means that our range of 95% of cases is a tiny something over 0.1 diopter. This is some better than other chain flux or other placebo devices. And in terms of axial length, it is giving us a very, very similar result as other PCI, so OLSCR devices, which is a within subject standard deviation of the axial length of around 0.01 millimeter, 0.02 millimeters. And this is really, really precise. And it agrees perfectly with other machines that, as you know, optical devices were calibrated against immersion ultrasound back with the first IOL Master, and they are getting all the same number. So you can tell that the axial length of the Pentacam AXL is interchangeable with other machines. Yeah, for sure. I think it's one of its main uses, as you're getting the anterior cornea and you're getting the posterior cornea. So first check, you can see the difference between the keratometric astigmatism and the total corneal astigmatism. And secondly, in your formulas menu, you've got two of the best performers in toric calculation, which are the Barrett toric and the Savini toric IOL calculator. So for sure, you are getting very, very accurate results with toric IOLs. And now it's one of the fields we are more worried about, the multifocal toric IOLs, where emmetropia is a must. Well, it's been my secret weapon for so many years, because I have always done the anterior surface with keratometry of biometers, but the posterior came from the Pentacam. I measured the posterior cornea, so the main source of error in post-refractive eyes, which is the change of the anterior to posterior ratio, is fixed. So I have always taken the posterior cornea from the Pentacam, input in a pseudo-phakic thick lens model, and do the calculation by ray tracing, just the same as Tom Olsen's Phac Optic does right now, and you can get the perfect result because you are not suffering the keratometric error. Yeah, the keratoconic eye typically takes you towards the hyperopic side of the refraction. So there is hyperopic error because the posterior cornea is too steep in relation to the anterior one. And this is making you overestimate the corneal K value. If you take a look at the posterior corneal radius as measured by the Pentacam, and you just divide the anterior radius in millimeters by the posterior radius in millimeters, and you see that you are going upwards from the normal ratio, which is around 121, and you are, let's say, 130, you should be aware that you are overestimating corneal power, and you should decrease a little bit the value of that K value in your calculation, or other thing you can do is just aim for some myopia, which in grade 2, grade 3 keratoconus will be around 0.5 to 1 diopter in the final target. Sizing the ICL is a matter of knowing the anterior segment dimensions. And of course, if you don't do UVM, you don't really get the sulcus to sulcus, which is the final target. And if you try to estimate from anterior parameters, probably the best correlator will be the angle to angle. And you can measure angle to angle with your manual caliper with a Pentacam. You can also take, of course, the white to white, which is the measurement that the STAR calculator is using. But I would suggest very strongly to take a look at the angle to angle, make an agreement between these two measurements, and then with that, take the decision of what ICL to implant. And very importantly as well, in the post-op, the Pentacam helps you measure correctly the bolt and also the anterior chamber angle. And these two factors are telling you if the lens is correctly sized or not.